Hello, my name is Tidra and I'll be your nurse for today. Can I please have your name and date of birth?
Vanessa Dawkins, 555.
Okay, so today, Miss Vanessa, I'm going to be showing you how to do a breast cancer self-examination, or not even saying cancer, but just in general, just to see if anything is wrong with your breast, just a breast examination, period.
Okay,
So before doing so, I'm going to go ahead and ask you a few questions, if that's okay.
that's okay.
Okay, so the first question is, have you ever noticed any discharge from your breast or anything?
No,
What about, have you ever felt any pain or discomfort?
no,
What about, have you noticed any lumps or mass?
no,
No. Does anyone in your family have a history of breast cancer?
a few.
A few. Have you ever had a history diagnosed with breast cancer before?
No.
No. Okay. Well, those are all the questions I'm going to be asking you. Now I'm going to actually go ahead and show you how you would check your boobs just to make sure that everything is good. And this is something that's good for you, being that your family have a history of breast cancer, which is possible that you, let's not say you will, but anything is possible. So we just want to be safe so you can catch it early if it was supposed to happen. So first, we're going to start with all about visual. So you're going to start by raising your hands above your head. And then at that point, you're looking for, well, before raising your hands above your head, you can start off by actually putting it on your hips. So you have a visual of both boobs, and you're looking for the shape, the color, and the size, making sure that everything is good. It's always good to have a baseline so you know what your breasts looked like before. So each time you do it, you'll know if there's a change. So you're looking for if there's any redness, any swelling, if it's sore, tenderness. All those could help in determine if something is wrong with your boobs. So you're checking for those, and then you could also go ahead and raise your arms for the second step. And when you raise your arm, you're doing the same thing. You're looking for the shape, color, because raising your arm gives you more access to view the size as well of your boobs. So you're raising your arm, you're checking for the same thing you did in the first step, but you're also going to check for any discharge from your nipples. And the nipples could come out as bloody, milky, clear discharge. It doesn't matter. So you're checking for that. You need to be right on that. Report that to a doctor if you find that, if anything was supposed to be like that. Also, when it comes on to your nipples, you also have to check to see if your nipples have moved or to any area, because maybe swelling could cause your nipples to maybe shift or something. Also, you're checking if you have any inverted nipples. So if your nipples are inverted, that's something to also report to your doctor as well. The next thing to do is check your boobs while laying down. So while you're laying down, at this procedure, you would basically use your right arm to check your left breast. So it's like opposite. So you would go ahead and use your fingers, flat fingers, and you would do it in a circular motion, like a quarter. You're trying to feel in a circular motion all the way around, and you're trying to cover all of the tissues. So covering the breast from top to bottom and side to side from your collarbone. So starting from up, that's a good thing, to the top of your abdomen. So you're coming down and then going around. And you're doing the same thing until you come all the way to the nipples. Okay, so once you have that done, you would go ahead and do the same thing to your other breast. So you would use your left arm to inspect your right breast. And once that's done, you could also, the fourth step because a lot of people think that it's more easier to do it in the shower when it's slippery. It's more easy to access, feel. I guess because it's like slippery, the water makes it slippery. So it's easier to do it in the shower, so you could go ahead, do it in the shower, and you would do the same thing. You're feeling for lumps, bumps, any soreness, and it's good to make sure to get everything. You're getting the sides, and you're going all the way around to the nipples. You could also start from in an upward motion. You could start up and go down, or down and go up, as long as you get everything. And make sure to feel properly. And that's it. Do you have any questions for me?
No.
No? Can you show me how you would go ahead and and palpate your breast if you were supposed to do an examination of
Alright,
it.
you said I should start on the shoulder blade
Mhm.
and go all the way down, and I'll palpate, and I'll go in like a quarter.
Okay, what are we feeling for?
I'm feeling for lumps and bumps
Okay.
or any irregular tissue.
Mhm.
Yeah, and I'll go all the way around until I'm at the nipple,
Yes.
and I'll cover the entire breast tissue.
Yes, that's good. So, and remember, once you find any discharged inverted nipples or any tenderness, it's always good to report this to your doctor just to be safe.
Alright.
And also I have the website right here. It's actually the breast cancer, you go to breastcancer.org, and it has the steps you could follow. And just in case you forget, but I'm sure you'll do fine. But this is something you want to try and do maybe every month, just so you could be on top of it. It's always good to be on top of your health. Is that it?
Alright, thank you.
Well, okay, that will be it for the video. Thank you.